Children's Law Center was founded in 1996 by a young lawyer who realized that his client, a teenage girl in foster care and pregnant as a result of a rape, faced so many challenges that even with his help, she couldn't successfully advocate for what she needed to be safe. She had no voice, so he made it his mission to create an organization that would speak for her and all vulnerable children in D.C. Children's Law Center works to give every child in the District of Columbia a solid foundation of family, health, and education. We achieve this by looking at what it will take to get each child safe, healthy, and ready to learn. Our comprehensive advocacy finds decisive interventions that will have the greatest long-term impact on children's lives. We leverage our expertise in 3 ways. We train and mentor volunteer lawyers from dozens of major law firms, who together represent hundreds of clients every year. Our policy team uses the expertise gained from helping more than 2,000 children each year to identify the most pressing problems, and then crafts system-wide solutions. Also, each year we train more than 1,000 parents, grandparents, pediatricians, and social workers to be better advocates, giving them the tools to fight for the children in their lives. Children's Law Center is effective because we get to the root causes of trouble in children's lives and find lasting solutions. Our comprehensive approach, focusing on family, health, and education, means we leave every child safe, healthy, and learning. We're successful because we hire the best and brightest staff and give them the training and support to make real change for children. We keep workloads manageable because we care about quality more than quantity. And we've had a lot of practice doing what we do. Children's Law Center has helped more than 20,000 children. Simply put, we track the number of children we help and how well we help them. We help thousands of children and families every year. We have a full-time evaluator on staff to help us measure our effectiveness so that we can guarantee the best outcomes possible for all the children we have yet to meet. What is a successful outcome? It's Ramon, an 8th grader who couldn't read when he came to us. But with our help, Ramon graduated high school on time and proudly read every word of his diploma. The biggest misconception about our work is that our staff spends their time in a courtroom arguing before a judge. But that's only part of the story. Our advocacy is successful because our lawyers spend most of their time outside of court. They check on children in their foster homes to make sure they're safe, attend school meetings, find funding for therapy, and help teens apply for college. Our goal is to give children the tools to succeed, and we do whatever it takes to make that happen. This is what children's advocacy means to us. As an organization, Children's Law Center has many accomplishments to be proud of. We've made it easier for thousands of older children to be adopted by shepherding 4 laws through DC's legislative process. We've advanced the issue of children's mental health and won the backing of the Washington Post, who recognized us as a leading advocacy organization. And we've leveraged our resources to help more children by building a robust pro bono network. What matters most at Children's Law Center is what we accomplish for the children we help, more than 20,000 since our founding. This means securing counseling to help an abused child learn to trust her adoptive mother, and fighting to get a teenage boy into the right school so that he stops skipping class and graduates. It means getting therapy for a girl who struggles with debilitating depression so she gains the confidence to apply for college. A third of DC's children live in poverty, and half don't graduate high school. Thousands are at risk of abuse and neglect if their family's circumstances don't change. These are big problems. But the bigger problem is that some people think they're insurmountable. We know they're not. Children's Law Center helps individual children and families find the path to success. Our advocacy prevents child abuse and gets struggling students to graduate. We see the children behind the statistics. Our ongoing challenge is convincing others to do the same and to never give up on our community's children. Children's Law Center is planning for growth so that we can help even more children and families. We're working to expand our medical legal partnership, where lawyers work with pediatricians to overcome obstacles that get in the way of children's health. We have clinics around the city anxious to partner with us, but we need more resources to increase our capacity. We're also focusing on preventing problems before they start, putting very young children on the path to success. But continuing to develop our expertise through rigorous evaluation and research about best practices requires more resources as well. Unfortunately, there's a tremendous gap between how many children need our help and how many we're able to serve. More than 45,000 children in D.C. live in or near poverty. Their parents can't afford to hire a lawyer if, like Ms. Harper, they need to fight the school that refuses their son an education because he's in a wheelchair. Or, like the Gonzalez family, a landlord refuses to clean the mold that's aggravating their daughter's asthma and sending her to the emergency room instead of the classroom. Children's Law Center helps 2,000 children and families like the Harpers and the Gonzalezes each year. But the need for representation is much greater. This is the gap we'd like to fill until all of DC's children have a solid foundation of family, health, and education.